Alrighty, let's go ahead and get started. It is showtime. Hello and welcome to today's webinar, No More Missed Calls, Automating Patient Intake with Conversational AI. My name is Samantha Burke and I'm NERUCA's Administrative Director, and I'm so glad that you could join us here today. But before we get started, just a few quick housekeeping items to help you make the most of today's session. This webinar is being recorded, and following this session, you'll be able to access the recording on demand through Zoom and via our YouTube channel. We'll also have time for Q&A at the end, so please do feel free to submit your questions at any point using the Q&A chat box at the bottom of your screen. Now, for those of you who may be new to us, NERUCA is proud to be in its 13th year of serving the urgent care community across the Northeast region. And we really work to strengthen and support urgent care medicine by doing a few different things. First things first, providing grassroots representation at the local level. We also tackle legislative issues at the state level, and we work hard to integrate urgent care into broader public health initiatives. And lastly, we work hard to deliver education and outreach to elevate the role of urgent care throughout our region. Now, we bring our mission to life through engaging programming, including today's webinar and our annual conference, which, if you haven't heard, will take place this year on October 4th to October 6th at a new venue, Mohegan Sun in Connecticut. And lastly, I would like to thank our corporate sponsors for the continuing support. Shout out to Aptitude, BD, BioReference, Exteon, Fresh Paint, Health Track RX, Metro Health Bill, Midmark Corporation, Pfizer, Solve, Medline, Healthium AI, and of course, a special thank you to today's sponsor, Hello Patient. And with that, it is my distinct pleasure to introduce you to Alex Cohen. Take it away, Alex.
Thank you, Samantha. Great to have everyone here and appreciate you spending the next hour with us. We're going to talk about conversational AI in the healthcare clinics and how top practices are already using AI to automate a whole bunch of their patient communication. I'm going to do my best to not make it just a big Hello Patient ad for the next hour, but actually talk more holistically about ways that conversational AI fits into different clinic workflows, and where it works well today and where it doesn't work well today. And just for some background on myself, I spent about 4 years in urgent cares as part of a large chain that had about 150 clinics. We built all of our own software across the whole stack. So on the patient side, we built our own patient portals, patient apps, booking, bill pay, things like that. On the provider side, we built all of our own. We built our own EHR, so we did all of our own scribing, billing, coding, check-in, everything like that. And so we were a full stack urgent care provider that ran both our own clinics and our own software. And I spent about 4 years there running everything on the consumer side before starting Hello Patient, which we have been working on for the last 2 years. Today, we're about a 40-person team based in Austin, Texas. All we focus on is patient engagement for healthcare clinics. So we just work on the workflows that touch patients directly. We don't do the back office pieces at the moment. So it's anything that would involve patient communication across voice, SMS, or chat. So with that said, we will hop right into it. So I think the biggest thing to start with is just the opportunity cost of not bringing conversational AI into the clinics today. And so, for most clinics, everyone has this problem where calls are just unanswered that come in. You're paying for ads across Google, ZocDoc, Healthgrades, a bunch of other places. And ultimately, it's the goal of the clinic and the job of the clinic to answer all those calls and get those patients scheduled, or else why are you spending money on ads if those are just going to be lost patients? And so what we see across clinics today is on average 20% of incoming calls go unanswered. Of course, that flips to oftentimes 100% of calls go unanswered after hours. And oftentimes patients are getting lost in the phone trees. They're getting lost waiting on hold. There's another 15% of callers who just hang up before they ever speak to the front desk. 20% of total call demand comes outside business hours. So right before you open most often and right after you close. Sometimes there's some calls in the middle of the night, but it's often in those peak hours right before clinics open and close. And 75% of these callers don't call back. They just call another clinic, whether that be urgent care, ENT and allergy, or primary care. They want instant answers. And so oftentimes they don't try to call back and wait on hold again, or they wait several days to call back, or you just lose that patient altogether. On average, that's $200,000 to $300,000 annually per location that's lost just for missed calls alone. And the math is really simple. Let's say the average clinic gets 1,500 calls per month, which is not that many. It's 40 or 50 a day. 20% of those calls are missed. Those are 300 missed calls per month. What we see is about 40% of those missed calls are appointment related. And so when you just do the simple math, 120 missed calls, calls related to appointments that are missed every single month times $150 average revenue per visit, it's $18,000 per month in missed visits. And so it's a real impact, especially when you're running clinic chains of multiple clinics. These numbers really do add up, and it's something that you can finally use conversational AI to help recover those missed opportunities. And this is really what we at least believe a world-class modern healthcare practice looks like. Every call is answered every time, 24/7, 365. Patients can book when they want. Oftentimes they're calling you when they're off work, which might be in the evening, it might be first thing in the morning, it might be during their lunch break. And ironically, it happens to be your clinic's lunch break as well. Might be on the weekend and you're closed during the weekends. Recall should happen automatically, not when the team has time. And so you think about different workflows like outbound campaigns to bring those patients back into the clinic. That should be consistent and predictable, not just when the staff finally has some time and they can work on these outbound campaigns. Insurance is verified before patients walk in. So like, how do you make sure that someone has given you their member ID? They have given you the proper insurance plan. You shouldn't have to be scrambling for these things last minute and explaining to patients in the front desk why their why their insurance isn't accepted. And then balances are collected via text and not awkward front desk conversations. There's so much that we can do now over conversational text to get outstanding bills paid. And this should be programmatic. It shouldn't be something that, again, the team hopefully has time to go do. And ideally, your team is just focused on patient experience, not playing phone tag. And oftentimes, patients are in the clinics, they get busy, the phone's ringing off the hook. Finally, the team frees up, they call back, that person misses the call, they call back again, and you just end up in this ongoing cycle of endless calls coming into the clinic. And it's something that clinics just can't turn off. If you turn off your phone lines, you essentially lose patients. And so this is something that unfortunately is a necessary evil. Is just patients like to call, to book, to talk to someone, to talk to the clinic. And we need to be able to answer all those calls 24/7 without creating a bad patient experience. And here's what most practices do today. Sometimes they use an answering service after hours. They're quite expensive, and all they do is take a message and send it to the provider on call, or they say call back in the morning. You always have a phone tree, and so it's press 1 for this, press 2 for that, and patients get lost, and they spend a couple of minutes just navigating a phone tree and waiting on hold to maybe talk to someone eventually. Today, most tools are one way. And so if you think about what a traditional practice does from a marketing perspective and a patient recall perspective, you're going to send a large campaign out that says, hey, you're overdue for a flu shot. Why don't you come in or call the clinic or click this link? But if someone has questions like, why do I need this flu shot? How do I book an appointment? Do you still take my insurance? Either you're not monitoring those numbers for incoming messages or replies back to the clinic, or you disable those messages and they end up calling, which creates more calls coming into the clinic, or those patients never self-service and book. And oftentimes this is manual. Like there isn't a ton of great ways to do this today. You export a list from the EHR, you put it in some spreadsheet somewhere, you hope that the team goes and works through that list, you hope that they follow up and they repeatedly try to reach out to those patients, and it's only utilized if someone has time. And then the front desk really does the heavy lifting around all this work, and that's hard. You have a lot of turnover at the front desk. They have a lot of other tasks that they're doing, checking patients in and out, answering other calls, scheduling patients, verifying insurance, collecting payment. The list goes on. Obviously, they're not just solo focused on answering calls and doing this work or answering messages or reaching out to patients. And everything today up until now really has been manual solutions and all sort of a hodgepodge of tools that you go slap together to try to make this work across the entire life cycle of a patient. And that's really the focus of this presentation, is to talk about like where conversational AI fits into the mix. Not just us, there's a bunch of folks working on different parts of the stack with AI, but we can finally move from manual solutions to programmatically doing all of this work in the clinic. And And this is really the gap and the jump from a bunch of fragmented tools to conversational AI. Fragmented tools notify your team when the team needs to do something, and it still puts that work back on your staff. Um, Patients text in, the staff sees it, the staff responds. It's all manual. It is most helpful during business hours. So oftentimes when the team is doing stuff manually, it's very hard to close the gap after hours or weekends or early closures and things like that. And really, there is clinic phone overload. With conversational AI, the AI actually does that work now. It reads and writes back to your EHR, back to your practice management system, and it goes from notifications for your team to do something to notifies your team when it has actually done that work that's in scope. And now when patients text in, instead of the staff having to reply and go work through an entire text inbox, the AI can actually handle it. And then the staff just gets confirmation again when that work is done. Um, AI never calls out sick. It never takes off time for holidays. It really does work 24/7, 365. It has unlimited bandwidth. You don't have to go think about staffing 100 AI agents. It's one AI agent that can do hundreds and hundreds of calls and conversations at the same time. And it really doesn't require staff to be involved in a whole bunch of these routine workflows that we now can basically move to AI workflows. And traditionally, you would buy software to help your team, whether that be text messaging software, whether that be CRM style software, whether that be the contact center software. But now you can actually deploy AI that augments and complements the team and does real work. And so just looking at a visualization of what happens when patients can't reach you, um, oftentimes these calls really cluster around three different times of day. And so that's in the mornings when you first open, oftentimes right before you open, patients try to call and get ahead of the phone queue, get ahead of those busy times. It's a lot of calls during that period of time in the morning. Then there's lunch calls, while patients actually go on lunch to finally call and say, hey, I need to book an appointment. I finally have a free block during the day. Those calls are often missed because your staff is also coincidentally on lunch during those times as well. And then there's after hours calls that are missed. And that would be really like after 5 or 6 p.m., the clinic is closed. It's 20% of the daily volume in many cases. There's zero staff coverage, or you're paying for an expensive after hours answering service. But all in, it's a lot of missed calls across the three different clusters of time. And majority of these calls are new patients. I mean, these are really high value calls that are being missed. They're not just existing patients calling about a follow-up or calling about lab results or billing or something like that. And there are many of those calls as well, but these are all brand new patients. They found you on Google, they found you on Yelp, they drove by the clinic, they found you on ZocDoc, and they're calling in to try to schedule that initial appointment and get access to care, and they're being dropped somewhere in that funnel. And so majority of those patients hang up, they never leave a voicemail. And again, a vast majority of them will just try calling every other clinic down the block, whether it be dental chains, whether it be urgent care or someone else. They're going to try to find someone who's going to answer their call and actually schedule them for an appointment. And so conversational AI can finally do scheduling. This is something that has been very, very hard to do in the past. 5 years ago, when I took over the call centers at Carbon Health, which is where I worked, I tried to automate all of this work. We were working with a big contact center vendor. This was the first question I asked, is like, why can't we just put some intelligent system inside of the phones to be able to say, hey, patient, do you want an appointment? And at that time, I wanted to do something as rudimentary as press 1 if you want 3 o'clock or press 2 if you want 3:15. Pretty janky experience, but it was really the only thing that we could even attempt to do at the time. And it was still incredibly difficult. We never got to a place where we automated these inbound calls to actually get patients onto the calendar. And at that time, we were getting somewhere in the realm of 10 to 20,000 calls per day across the clinics. Obviously, COVID was a crazy time. Everyone was calling in for a number of different reasons, but a lot of it was COVID testing and things like that. But these were all routine calls where there should have been something that automated it so that we didn't have massive abandonment rates inside of the clinics. So now when a call comes in, and we'll do a demo right after this slide, call comes in, the AI answers it. The AI can determine if it's a new patient or an existing patient because we can actually pull that record directly from the EHR finally. And if they're a new patient, your AI should be collecting their information, figuring out what they're coming in for, gathering insurance information, and then actually booking them to the schedule. If they're an existing patient, the AI should be able to look them up based on phone number, date of birth, things like that, and actually go schedule that follow-up visit or a new sick visit, whatever they need. And AI is finally smart enough to do a lot of the triaging. And so there's a lot of things that I think is important as you're evaluating conversational AI to say, like, what is out of scope? Like what do we not want AI actually scheduling for patients? That might be post-surgery follow-ups. That might be you know, drug screenings. It might be something else that's more complex than what you want an AI to handle because you don't want to create more friction inside of the clinic. But ultimately, what's really cool about AI is that it can determine if something is in its scope or not. If it's in its scope, it will attempt to do the thing. Okay, this is a scheduling call. It's related to an annual wellness visit. I need to get this patient scheduled. Let me follow my protocol and procedure for doing that work. If it is not in scope of the AI, it will say, let me transfer that call out to the team. Let me create a task for the team, whether that be in Slack and Teams and the EHR, wherever it is. But AI is really good at not having to use keywords to determine what's in its scope or not in its scope. And then there's a whole bunch of workflows that AI can finally do well, which is, scheduling is the big one that we always talk about. It's probably the highest ROI use case because these are just like new patients getting scheduled for appointments or new appointments getting scheduled. FAQs, really easy for an AI to look up what's in its knowledge base and say, yes, we're open until 8 p.m. Yes, we have parking. No, we don't take this insurance. Yes, we take this one. For medication refills, it can actually create tasks in the EHR finally to for a nurse or a provider to go review and say, let me go refill this medication for a patient. And then for billing, there's a lot of incredible stuff that we can do around billing finally, which is answering questions about a bill, explaining what they were charged for, explaining when the bill is due, how to pay the bill. In our data, almost half of calls that come into the billing call centers or into the clinics regarding outstanding balances are just explain my bill. Like, why didn't insurance cover this entire thing? Why was I billed for, for a bundle of like strep tests with other types of, tests all in one? And the AI can finally do a lot of this work and answer questions that don't require a human just explaining the bill over and over and over again. So with that, I think now is actually a good point to pause. And what I will do is share I guess, yeah, we're going to do a live demo call, but let me go ahead and share my screen, a different screen now. And so this is just Google Voice. Samantha, you'll have to let me know if for some reason you guys can't hear when this starts to ring. But I'm going to go ahead and call a live clinic that has AI sitting as its front desk right now to handle calls coming in.
Hi, I'm a virtual agent with PulseMD Urgent Care. What brings you in today?
What time are you guys open till today? And can I just walk in?
We're open until 8 p.m. today, and yes, walk-ins are welcome. Online check-in is available too, but it's not a guaranteed appointment time. More urgent cases are prioritized as they arrive. Anything else I can help with?
Okay, can I just schedule over the phone then? I think I might have strep throat. I've just had my throat's been hurting for the last couple of days.
Let's get you seen at our Poughkeepsie North Road Clinic. Earliest opening, or do you want a certain time today?
This afternoon would work great if you have something there.
I'm seeing the next opening at Poughkeepsie North Road tomorrow, April 8th at 8 o'clock in the morning. Does that work?
Do you have anything tomorrow midday?
Yes. I've got tomorrow, April 8th at 11 o'clock in the morning at Poughkeepsie North Road. Does that work?
Yeah, I'll do the 11 a.m. That's fine.
Now, I just need to collect a few pieces of information and we'll get you all scheduled. Could you spell out your first name for me so I can create your patient account?
Yeah, it's LeBron, Lebron.
I have that as Lebron. Is that correct?
Yes.
And could you spell out your last name?
James, James.
Got it, LeBron James. What's your date of birth?
March 2nd, 1987.
March 2nd, 1987. Is that right?
Yes.
What's your email address?
It's LeBronJamesTheGoat@gmail.com.
I have lebronjamestegoat@gmail.com. Is that right?
It's LeBron James and then the goat, THEGOAT @gmail.com.
I have lebronjamestegoat@gmail.com. Is that right?
Probably.
What is the name of your insurance provider?
I have Aetna.
What type of plan is that?
I think it's a PPO plan.
Great, let me set up your patient account. This will just take a moment. I'm having a little trouble booking that exact time. The 11 a.m. slot might have just been taken. You can still walk into the clinic, or I can check for other times if you'd like.
No, I'll walk in. That's fine. Can I just walk in today?
Yes, you can walk in today. We're open until 8 p.m.
Okay, thanks so much. Cool. All right, so let me go back to the presentation real quick. Okay, so we don't do fake demos, so that was a real call. And it is possible that for some reason the agent couldn't actually book the that slot in their system. In particular, that urgent care uses a bit more of a more challenging EHR to integrate with, and so we see this in the EHR integrations, which is it is a real dependency on getting these things live, but we always have backup protocol. The agent could transfer me to the clinic. It told me to walk in. We don't want to lose that patient, even if we can't book that appointment directly. And so, yeah, that's a real call. Again, the AI sometimes could have trouble pronouncing email addresses like it did there. And I think it's important to actually see what a real call looks like. You'll see oftentimes very polished demos where it shows the entire happy path experience end to end. We don't do that. And I think when we get into like, how do you choose an AI vendor? That's a really important piece is, do they have real calls working in production? Does it handle weird edge cases and weird errors like this and handle those things gracefully? But what's really important is that it does answer the calls immediately. It does understand the intent for why someone is calling in. It does triage correctly. So if I actually said I've got chest pain or I've got I'm like profusely bleeding, it would transfer me to the clinic or tell me to hang up and call 911. That works after hours as well. We don't want to miss patients after hours, and it knows when to hand off those calls. And so we did that live demo call. It did triage me as a new patient, did ask for my insurance, my demographics. It did go back and forth with the slots. Like the first slot didn't work. I asked for an afternoon. It did find me a late morning. And again, really important that when you are looking at vendors and you're evaluating who you bring in to handle those front desk conversations, is the AI natural? Does it do the real-time sync with the EHR integration? Can it intelligently route based on the different symptoms? And then can it actually book those appointments? And I would add on top of that, does it handle issues gracefully? Does it know how to handle these errors? Because the EHRs will always have errors. I think anyone that promises you that they have a perfect EHR integration and it's never going to throw errors, it's just not true. We've done probably 30 or 40 EHR integrations at this point, and it's not been true in any single one of them. Cool. And research really does show patients are more likely to trust a provider that uses AI, and they really enjoy being able to get through a flow quickly without having to wait on hold and talk to someone. They want to book on their schedule. They don't want to book on your schedule, not just during business hours. Right now, we're all on this webinar. If I like couldn't call my provider and say, hey, I want to book an appointment right now, I'd have to wait until I free up today and I'm not on calls. Oftentimes, patients also like to text over calling. That's one important thing, is that these agents are multimodal and they support texting and calling. And you want to meet patients where they are, especially the younger generation likes to text. They don't like to call. They really want quick answers to simple questions. Do you take my insurance? What time is my appointment? Can you book me for this thing? Do you guys have an X-ray on site today? I think it's very important that two things happen. One is that the AI can actually answer these questions well. The other is that it identifies when something is actually a scheduling related intent. And so the way that any good AI vendor should train their AI model is to say, okay, someone's calling in about an X-ray. That's not their only question. They're calling in because there's probably some inclination to come in for a visit. So how do you encourage them to go from, yes, we have an X-ray on site today. Can I help you get scheduled? What do you need to be seen for? And encouraging that conversation. So it's not just a Q&A and then it hangs up the call. And then ideally everything is self-service. I mean, the way that we look at this is it really is self-service now, just over the phone. And so you have the ability now to do the same workflows that you would traditionally put into a web scheduling form, but now an AI can do it over the phone or over text with a patient. And so, yeah, for SMS and text best practices, the goal is to really meet patients where they are, respond very quickly. You don't have to wait until someone frees up and looks at a text messaging queue. It makes rescheduling really easy. Instead of now getting an appointment reminder that says, hey, just a reminder, you have an appointment tomorrow at 3 p.m. Call us if you need anything changed, or call us if you have questions. Patients can now respond over text and get everything resolved that way. Texts are very easy to personalize. They should always be personalized, and everything should be customized to your practice, your brand, your style, how you talk to patients, how you confirm appointments, how you reschedule, that language and tone and copy. Just for the purposes of this webinar today, we're not going to do a live demo text, but you can always go to our website, put in your phone number, and the AI will send you a text, and you can actually play with everything over text on our website. But a few good demo scenarios to think about here would be texting to book an appointment. It's all the same infrastructure under the hood for how you triage a patient, how you identify that they want to come in for an appointment, how you identify that they are an existing or a new patient, how you find available times at their preferred location and actually confirm insurance details. Text is great because patients can do it on their own time. You can go back and forth over 30 minutes to get an appointment booked. It doesn't have to be real time like a phone call. And same thing with texting. It should be conversational. It should be able to handle and pivot different questions during the conversations mid-flow, and it should sync back to your EHR. This is not like a dumb text agent that's going to say, click here to schedule an appointment or call the clinic and just answer FAQ. Anyone can offer an FAQ text agent. I think where the magic really happens is being able to do stuff in that same message thread with a patient, similar to what we do over the phone as well. And let's pivot now to outbound. I think we talked a lot about inbound. Inbound is such an important piece because, again, you can't turn that off. You have this nonstop funnel for patients finding you. They call, they want to book. It's just kind of the way that healthcare works today. But outbound's the other piece, which is a part that you control. You control how much outbound you do, when you do outbound, who you're going to reach out to. The problem is that everyone is very resource constrained and does not have the staff often to go do mass outbound campaigns that are conversational. And so you're stuck traditionally doing static messages, which would be, hey, how was your visit today? Click here to leave us a review. That is not as exciting as, hey, this is Mia with Pulse Urgent Care. How was your visit? Can you tell me more about it? And then you can go back and forth with a patient now over text and actually flag actions. You can flag the team. Then you can ask them to leave a review. It's a much different conversational style experience to what we are accustomed to. And in an ideal world, you would have someone, maybe it's the practice manager, maybe it is the front desk, maybe it's, someone at the clinic asking a patient how their visit was and following up on that visit. They just don't have the time to do that for the 40, 50, 60 appointments that come in every single day. And then you have more of your mass marketing campaigns, the seasonal ones. Hey, it's flu season. Have you gotten your flu shot yet? Or hey, you're overdue for this annual wellness visit. Or hey, like you haven't purchased your hearing aids yet. You were in for an audiology or for an audiogram, and the provider said you should get hearing aids. Like, why haven't you purchased your hearing aids yet? So now you can do all these outbound campaigns to either close care gaps, to do patient recall, to do marketing style campaigns, ultimately with the intention that you have a higher conversion rate of getting that patient into the clinic and scheduled for a visit. And so now the conversation goes from, I keep getting these from like CVS as an example, like, hey, flu season's here, like click here to schedule your flu shot, and it just over and over and over and over again. And I actually like replied to one of them a week ago, and I was like, why do I need a flu shot? And the AI or their system just goes, sorry, I don't understand, replies to this number, please click here. And I was like, okay, well, I'm not going to go click here to go. And it was like a completely irrelevant link to what I had asked about. And I think now you can do something like, hey, this is, and I'll use CVS as an example, like, hey, this is CVS, flu season's here. Have you gotten your flu shot? Do you want me to help you schedule that? And if the patient goes, no, I haven't gotten it yet, then the AI can have a whole conversation around why it's important to get a flu shot, how to schedule it, can they walk in, what times are the locations open? And now we have the capability to bring that to every practice, not just the big groups like CVS. Then you have appointment reminders. That's another big piece. Obviously, everyone hates no-shows and hates when patients don't show up to their visit. And there's always contention around, do we charge a no-show fee? Do we take a card on file? Do we collect payment in advance? But I think part of the reason and what we see in our data as to why patients don't show up is reminders are just not that great. You're going to send a text reminder that says, hey, just a reminder, your appointment's at 3 p.m. tomorrow. Reply yes or Y to confirm your appointment. But then patients get stuck. If they actually have to reschedule, they now have to call your clinic. They have to click a link and go through what is probably a suboptimal form experience or workflow to reschedule themselves on their own or cancel that appointment. And again, now you have this conversational AI that can do that work for them. And then on the billing side, this is another thing, another really important workflow that we see across many of the groups we work with. Patients respond really, really well to conversational text related to their bill. Not obviously, we all send paper statements in the mail, and that's great. People read that and they go, I'll wait for the next one, and whatever, they don't pay. What really works is getting consent to be able to text patients and call them with AI regarding their bills and saying, hey, Alex, you have an outstanding balance of $50 from your visit on January 2nd. How do you want to pay? And you reply and you're like, I can't, or the patient replies and they go, I can't afford that bill. And now instead of you not being able to capture their intent as to why they can't pay their bill, we can reply with, oh, did you know we offer payment plans and it's really easy to set up? Did you know that you can, pay in installments? Did you want to talk to the team about a discount or a credit? And you can finally capture a patient who historically maybe would just ignore that bill over and over and over again. And now you can understand why they can't pay and work to overcome that objection and get that bill paid. And outbound billing campaigns are such a great use case of AI now because they can do it at scale in a way that static bill pay messaging could not work previously. And here's a good example of a flow that we would set up to try to capture that patient for, let's say this is a post-visit follow-up. So patient comes into your practice, they had a visit, we get a trigger that the appointment was completed, and then we can configure this campaign to be 1 day, 7 days, 30 days, 6 months, like really however long you want to keep trying to talk to the patient. And now what any good conversational AI vendor should be able to do is go build an outbound campaign flow that works for that works for doing this style of cadence. And so you think about like the first text that goes out, hey, Alex, how was your visit? Are you feeling better? It can be as open-ended as that. And, usually we'll say like, I'm a virtual agent, but how was your visit? Are you feeling better? And they go, yes, I'm feeling great. I had a good experience. And we go, amazing. Can you leave us a review? We send them the link to the Google listing and ask them to leave us a review. And that workflow completes. The person gets exited from this campaign. Or they say, no, I had a terrible experience. I'm still feeling sick. And what we can do is flag that to the team so that the team can intervene and get ahead of that patient. Or they just like don't respond, and then we can do a second outreach and a third outreach and things like that. I think that this is a really important way to drive patient satisfaction higher, to drive NPS scores higher. I'll share a personal experience, which is I went to an urgent care probably 2 years ago for food poisoning. And I was in such rough shape. We lived in a neighborhood where we had golf carts and the urgent care was across the street. I couldn't drive, so I hopped in my golf cart. I was like, well, if I crash, like it's on me. At least I won't hit anyone else while I'm driving. And I took my golf cart across the street and went to the urgent care clinic about 30 minutes before they closed. And had probably the worst experience I've ever had going into a healthcare clinic. And they wouldn't see me. Like initially, they didn't take me back. I got back there. They were like, hey, we close in 30 minutes. I was like, cool. Well, I'm here right now. So like, please treat me. I need Zofran or something to just like calm the nausea. They go, oh, we're out of Zofran. So like, we'll have to write you a prescription. Anyway, it was awful. They gave me no time of day. I left that urgent care. Like I would have been better off dying on my bathroom floor at home. And so I got home, and the next day I actually left them a review on Google. And to their credit, their district manager called me, I think 3 or 4 days later, and was like, I'm so sorry. We had a per diem nurse on staff that day, all these things. And I was like, I appreciate the call, but also, yeah, it was a terrible experience. But they did intervene. It was just way too late. And I think we finally have an opportunity to get ahead of a lot of these experiences, because we know that not all 100% of patients are going to have a great experience at the clinic. To be able to reach out and say, hey, Alex, you came in yesterday for food poisoning. Are you feeling any better? And then I would have had the opportunity to say, no, I had the worst experience of my life. And that could have been flagged immediately to someone in leadership at the clinic or in the region to be able to then get ahead of it and reach out before I ever left that Google review. And that Google review still exists today on their, on their Google page. And like, it's an honest experience of what I went through. And I think that that's true for a lot of patients. And I don't usually leave negative reviews, but we can get ahead of a lot of this now by using conversational AI. Cool. And then just shifting gears into the revenue cycle piece, another really important part of the business for every clinic chain that accepts insurance. There's 3 pieces of when we believe that patient-facing rev cycle really matters. So the first is before the visit. How do you avoid surprises with the patient and say, yes, we take Aetna, yes, we take PPOs, yes, or no, we don't take Medicare, we take this instead. That is something now an AI can actually do per all the different insurance plans and types that a group accepts. Then there is at registration. If you've already pre-collected the insurance information up front, gives you an opportunity to verify insurance, to, if you're a specialty clinic, do any prior authorizations that you need to do. But ultimately, it means the front desk isn't scrambling at check-in. And again, there's no surprises. And lastly, it's after the visit. How do you get ahead of the bill pay conversations? How do you get ahead of insurance denying the claim because the insurance was inactive? How do you reach out to a patient and say, hey, do you have another insurance that we need to bill? Do you not believe that you were charged correctly? And so now AI can sit in all these different workflows, again, over voice and SMS, to get ahead of these conversations and actually resolve some of this work end to end, whether that be recollecting insurance information, explaining how to pay the bill, linking them to their bill to actually get paid. There's a lot of cool stuff that AI can finally do really well that helps solve the patient accounts receivable problem that a lot of groups have. And here's a really good side-by-side example of what many of our clinics had previously. So like, hey, Taylor, you have an overdue bill. Click here to pay. Hey, Taylor, you have an overdue bill. Click here to pay. And it's over and over and over and over again until you just like give up and you're like, I'm never paying this bill. Just send it to collections finally. And now you can see on the right what our style of campaign would look like. Hi, Taylor, I'm reaching out about an outstanding balance. You can pay here. This charge is for the balance remaining on your last visit after insurance paid their portion. And then Taylor's like, well, didn't I pay at the visit? I'm confused. And the AI will go, great question. Yes, you paid your copay, but the balance remaining covers your responsibility of services provided. Obviously, we get way more specific in real in real campaigns, but and we verify the patient and all that good stuff. But this really shows the difference in what a static marketing campaign looks like compared to a generative AI-powered outbound campaign looks like. One thing that's really important to talk about is no matter who you work with across the entire life cycle of a patient and where you fit these AI, conversational AI into your practice, the vendor must be able to integrate with the EHR. If they can't integrate with the EHR and practice management system, it really limits the capability of what you can do. Now, there is still work that you can do without having a direct integration. Again, you can text patients scheduling links. You can use manual CSVs to do outreach to the patient. It just means you're usually not able to read and write directly to the calendar. You're not able to pull patients automatically from the EHR. So as you're evaluating, you want your vendor to be able to integrate with your EHR. That could be ModMed, Athena, Xperity, ClinicalWorks, NextGen, like there's so many. But that's a really important piece. Now, the one thing I would say is oftentimes vendors, like sometimes we don't have EHR integrations as an example from day one. There's a bit of a chicken and an egg problem where it's like, have we worked with a clinic who uses some random EHR we've never heard of? I think it's okay to work with someone who has a track record of building great EHR integrations and being okay knowing that they can build that EHR integration in parallel with the work that they're going to do with your clinic. But ultimately, it's really important that you get to a place where there's a direct API connection to your EHR that allows the vendor to pull appointments, visit histories, balances, demographics, things like that. And it allows you to trigger those outbound campaigns automatically versus manually. And it really helps drive all the different workflows across no-shows, collections, things like that. One unified place, which would be the EHR for having all that data and being able to read and write to and from is really important. So as we start to wrap up this overview of conversational AI, really the difference of without AI and with AI is you go from 20% of missed calls to now 100% of calls are being answered and new patients are being captured. You go from patients who couldn't get someone on the phone and they call a competitor to now 24/7, 365 availability. You go from revenue that's sitting in the EHR to revenue that's now hitting your bank account as you're collecting on those outstanding payments. Instead of now having low patient return rates, you've got overdue patients who are finally being contacted, engaged, and booked. Instead of insurance surprises, you now have insurance that's verified pre-visit. And then instead of high unpaid balances, you actually have balances that are collected over text and you have decreased patient AR. So a lot of really great stuff that comes from conversational AI being added to the clinics. Now, it's not a silver bullet. It doesn't answer 100. It can't resolve 100% of calls on its own. It can't do a lot of the complex work like reading through the EHR to determine if if the coding was correct and things like that. But there's such a big chunk of work that's just routine and could be automated, which is where I think AI really fits well into the mix. And then, as you do some math to figure out like what's the ROI for a clinic like mine, you look at how many missed calls you have, how many are appointment related, how many you could capture, how much those are worth to you. You can look at the after hours calls that are being missed and how many could be captured. You can look at your collections improvement rates and look at the average outstanding bill, compare that to what a collection rate would be and a lift on patients actually paying their bills. And then there's also the staff time saved. If you have a front desk, often it's the decision between, do we augment with part-time staff? Do we hire a second receptionist? Things like that. If you have a call center, there's some math around, do we need a call center this big in order to support the same volume of calls? And then the last thing I think I'll leave you all with is as you look at evaluating AI, there's some really, really important questions to ask. Again, if you look at Hello Patient, ask us these questions. If you look at anyone else, ask them these questions as well. Does it integrate with your EHR and practice management system is very important because that ultimately drives, can it book appointments onto the schedule? Does it do voice only? Does it do text only? Does it do both? You should have both, but some only do one or the other. Some are not as conversational as they say they are. They say that they're using AI and they're really, I would say, legacy companies. They've been around for a while. They have a lot of tech debt. They just don't have true conversational experiences. What happens when it can't do something? Is it dead-ending a patient? Is it creating frustration, or is it actually routing to the clinic or to whatever escalation protocol it needs to follow? How customizable is it? Does it work for your SOPs and your workflows and your brand? And then what analytics and reporting do you get? How do you verify the AI is doing the right thing? Is it auditable? Can you see every conversation? Can you see every recording? And I think there's some red flags to look out for as you're evaluating anyone who says that they do conversational AI. Are they using just scripted chatbots? It's very easy to tell if it feels like the same message over and over and over again, and they're just using scripts. Do they not actually have a real EHR integration, or have they not done real EHR integrations before? I think a lot of folks claim, oh, we integrate with this vendor, and then they don't, and you find that out 2 months into the process. Are they only using one modality like voice only or text only or just a chatbot? I think, again, to capture as many patients as possible, you need to be multimodal. Do they have no clear handoff to humans? What do they do in those escalation scenarios? Or they really try a one-size-fits-all approach. I think any vendor that says, hey, we're going to get you up in 2 days or 3 days and it's going to work and we're going to handle everything, I have yet to see a successful implementation where that has been true. Healthcare is complex and this work is not easy. And I think it's important to know this work is not easy. And it takes a little bit of time and effort to get these things up and running properly and matching the protocol of each clinic. So with that, the key takeaways are conversational AI can finally be your team. Static tools help, but conversational AI actually does the work. The 4 areas that really matter are missed calls, patient experience, outbound campaigns, and RCM. 35 to 50% of calls can be fully automated away today. That goes back to my comment on it's not a silver bullet. It's not going to do 100% of your calls, but it will do a good amount of calls. And then integration is non-negotiable. Sorry, my Google Voice is ringing in my ears. Sorry about that. And then, yeah, integration should be non-negotiable. You should be able to book, reschedule, and sync to the EHR. And then you really need to measure what matters: answer rate, booking rates, containment rates, automation rates, recall conversion, things like that. So with that, that is all that I had for today. And I think we're going to open it up for Q&A.
Awesome. Thank you so much. So that does conclude our presentation. Thank you so much, Alex, for that lively discussion. Like you mentioned, we're going to now open it up for Q&A. As a reminder to the audience, please feel free to submit your questions using the Q&A chat box at the bottom of your screen. And let me see if we're seeing some questions come in.
We had one come in about outbound campaigns. I'm happy to take that one.
Absolutely.
Yeah, I think for automated outbound campaigns, the best thing that you can do is collect that consent in your patient consent forms. So there's a lot that you can do when a patient is checking in at the front desk or they're signing those consent forms. It's like basic language, and we've helped a lot of folks add guidance and language around this to basically add, like, by signing this agreement, I agree to receive automated messages from X, Y, and Z group, plus that are automated and things like that, by providing my information. There's a whole bunch of language you can add there. As long as they're in the consent forms, it's totally kosher to be able to reach out, because this work is it's not cold outreach. Like, we're not just buying a list of patients and reaching out saying, hey, come to our clinic. One thing to note is you'll need separate opt-in consent, like language around billing, than you will for other healthcare related purposes. So us following up about a visit is different work than following up about an outstanding bill. And we're really, really, like, stringent on compliance. And so we'll help you work through that. We're whitelisted with all the telephony carriers in the country. We do a lot of work there to ensure that we've got full TCPA compliance across the work that we're doing. Cool. There were some other questions that came in terms of pricing. The way that we price, and I don't actually know how others price, but I'll sort of talk out of principle. We are a combination of like a SaaS fee per clinic plus usage-based pricing for the work that we do. And the way that we've designed it that way is we might only start with scheduling, we might only start with bill pay, we might only start with after hours or missed calls, and you should only pay for what you use. And so the goal is the more volume you push through us, the more we get paid, but the more work that we're doing. The longer those calls are, the more complex they are, the more we get paid for doing those calls. And like not all 2 calls are created equally. I think oftentimes what you'll see is vendors charge a flat fee per call, like resolved call. It sounds really great when you first hear like, oh, we're only going to pay for calls that the AI handles on its own. The problem is when you're doing like 10 or 20 or 30,000 calls per month, even 5,000 calls, there's no way to verify, was this an actual resolution? Did the patient hang up early? Like, did we resolve the call, but then we transfer to the clinic? So like, does that count? Does it not count? And so we don't charge based on resolution for that reason. We charge based on usage and talk time of the AI basically, and it ends up being cheaper than hiring staff to go do that work. And it's fully utilized. You don't pay for like the AI to sit around and wait for a call to come in and things like that. And so yeah, we'd be happy to like share pricing as it really is dependent on number of clinics and call volume and use cases and things like that. But Sarah, who is our director of sales, and she's worked in urgent care for a long time, I believe she's in the audience right now, would be more than happy to work on sharing more specific pricing regarding like each group. And then there's another question here around how it picked a location. I actually called that clinic's phone number. So the way that we set this up, you can have we'll have two options. One is you might have a centralized call center. That's totally fine. You can call in and the AI will ask, hey, what location are you going to? Or do you want to be seen at? And then we have like the tools where the AI can look up all the nearby locations and then do all the same work. What we actually really like is when patients call into that clinic and we have a one-to-one agent with each clinic. And so we know when that call is forwarded from like the downtown Austin, Texas location, it goes to the AI and the AI knows based on where it's coming from, like, hey, you're calling downtown Austin. There's no reason to ask a patient that question of like, where are you going to be seen if we know what's where they were calling into. Now, if there's no availability there, and I could have done that on the presentation and said, actually, like tomorrow doesn't work, can you find me another location? It will find nearby locations and then it can search across all of them and find the first available, recommend that to the patient. And that can be based on, again, if it's urgent care, typically it's like X-ray availability would be the one limiting factor. But if it's like a general sick visit, it doesn't matter. If it's more primary care or specialty care, then we can look based on the service reasons that are supported at the different clinics and which providers are there. So it really is like very flexible in that regard to figure out how to pivot that conversation. But that's why for the Pulse is multi-site as well, and I just called into the one clinic number that I had on hand. But we could also set up another number that's more generalized that could live on the home page of the website versus the individual clinic pages. Yeah, there's a question around ROI. I think the best way to think about ROI is like you usually won't see an immediate headcount reduction or time saved through staffing. Like it really comes from scheduling more and more and more appointments and not missing any of those calls. We usually see like anywhere from 5 to 10x, sometimes even more ROI on our cost compared to the like volume of appointments that we are booking, because answer rates can be so low. And so we have some clinics that were previously at like 30% missed call rates prior to us coming in. And if you think about just like the sheer number of appointments that are not being scheduled because of that, our ROI ends up being very high, like 5 to 10x, usually on the low end of all of this. Bill pay and outbound campaigns are a little bit different. It's still like bill pay would be based on conversion rates and how much of that outstanding accounts receivable we're actually getting paid, and getting patients to like click the link and pay their bill, or getting them transferred over to the team to set up a payment plan or something like that. But outbound campaigns are very much like outbound. We just charge based on call and text that goes out. And so you can like take that math and say, okay, if we're going to do 10, I'll use simple math. Like let's say 10 text messages are $1. That's not what they cost, but like, let's say we did like 10 texts that are $1 and that person ended up booking an appointment after text 2, it would be 20 cents to literally get that appointment booked. And so that's the way to think about the conversion rate on those outbound campaigns.
Awesome. We probably have time for just one more question.
Yeah. How tasking can be operationalized. So we've done this now a few different ways. Some teams use like call center software, like a Freshdesk or a Zendesk or Zendesk or something like that. We can create tickets inside those tools. We can create tickets inside HubSpot. We can just post messages to Teams or to Slack where the team can review. What actually happens in Pulse's case, just because we did that call and there was it like couldn't book the appointment for some reason. And, I'll go figure out like why it had a bug. But the AI told me to walk in. We actually send a message to their front desk Slack channel to say, AI could not book appointment. This patient's walking in at this time and this date. And so again, not really a task queue like what maybe you're thinking around, some more formal task queues, but it's a good example of like that communication back to the clinic in the event that we need to pass something to them. But we usually, with APIs, we can conform to whatever the clinics are doing today in terms of managing their different to-dos. Yeah. And
Great.
then I guess that's most of the questions. We've got maybe one last one on what management system reporting is available. So the nice thing about us is we do all the hard work for the clinics. Like we manage the agents, we build them, we make updates and changes. It's very hard to build these agents correctly, which is why still most of this work happens through our team. But you'll get full reporting over like calls answered, scheduled appointments, transfer calls, dispositions, like everything that's very granular, why we transferred, why we booked, when that appointment was booked. And then you get dedicated account managers to basically close the loop on making clinic changes. So I see Faisal in the chat. It's like their X-ray availability changes often. And our team is right now managing those X-ray changes in the context of the agent for them. And we're building more and more stuff over time where like the different teams can control different elements of this to keep the AI up to date, essentially. But we work very closely to figure out on each unique scenario, like how to manage a lot of those operational changes. If you have an early clinic closure, how do we like make sure that the AI is not scheduling appointments that day? Little things like that.
Well, that's just about all the time that we have for questions today. If we didn't get to yours or if something comes to mind later, please don't hesitate to reach out to us at admin@neruca.org. We're always happy to continue the conversation. And I'm happy to close this out. So to Alex, during today's presentation, thank you so much for partnering with us on such an important topic in urgent care medicine. And it's been such a pleasure learning from you today. And to our attendees, thank you so much for your time and attention during today's webinar. We hope that you found this session insightful and valuable. And the recording from today's webinar will be made available on our YouTube channel in the coming days. So we really appreciate your participation and look forward to seeing you at our next session. Have a great day.
Yeah, thank you all.
See ya.